Welcome to the Competency Training Series for Direct Care Workers, presented by Silver Home Care. Today's topic is basic infection control. Let's begin. Infection control is essential in maintaining a safe environment for both clients and direct care workers. It encompasses a set of practices and procedures aimed at preventing the transmission of infections and protecting the health and well-being of our clients. By understanding the different types of transmission, direct care workers can effectively practice preventive measures and protocols to minimize the spread of infections and ensure a safe and healthy environment for everyone. Contact transmission is one of the primary ways infections spread. It occurs through direct or indirect contact with infected individuals or contaminated surfaces. Direct contact refers to physical contact with an infected person's body fluids or skin lesions, such as touching a wound or coming into contact with blood or saliva. Indirect contact transmission happens when pathogens are transmitted through contact with contaminated objects or surfaces, such as doorknobs, handrails, or medical equipment. It is crucial for direct care workers to be aware of contact transmission and take appropriate precautions to prevent its spread. Airborne transmission. Airborne transmission involves the dissemination of infectious pathogens through small airborne particles called droplet nuclei. Unlike larger respiratory droplets, droplet nuclei are much smaller and can remain suspended in the air for extended periods. This allows them to be inhaled by individuals who are farther away from the source of infection. Diseases like tuberculosis and measles can be transmitted through airborne transmission. Fecal-oral transmission. Fecal-oral transmission occurs when pathogens present in feces are ingested through contaminated food, water, or surfaces. This type of transmission is commonly associated with gastrointestinal illnesses like hepatitis A, norovirus, or salmonella. Poor hygiene practices, improper food handling, and contaminated water sources can contribute to fecal-oral transmission. It is essential to emphasize the significance of proper hygiene, including hand washing and safe food handling practices, to prevent the spread of diseases through fecal-oral transmission. Vector-borne transmission. Vector-borne transmission involves the transfer of pathogens from infected organisms, vectors, to humans. Vectors like mice, rats, mosquitoes, ticks, or fleas can transmit diseases. It is important for direct care workers to notify their supervisor if they see evidence of infestation with any of these pests to prevent the spread of vector-borne diseases. Preventive measures. Hand hygiene. Maintaining proper hand hygiene is essential in preventing the spread of infections. Direct care workers must understand the importance of thorough hand washing. Follow these steps. 1. Wet your hands with clean, running water. 2. Apply soap and lather your hands, including the back of your hands, between your fingers, and under your nails. 3. Scrub your hands for at least 20 seconds. 4. Rinse your hands thoroughly under running water. 5. Dry your hands using a clean paper towel. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol. Perform hand hygiene before and after direct client contact, before and after handling food, after using the restroom, after touching contaminated surfaces, and upon arrival for work and before leaving. Preventive measures, personal protective equipment, PPE. Personal protective equipment, PPE, is vital in reducing the risk of infection transmission. Direct care workers must understand the proper use of PPE. Follow these guidelines. Wear gloves when there is a risk of exposure to blood, body fluids, or contaminated surfaces. Change gloves between tasks after contact with contaminated materials, or when they become visibly soiled. When removing gloves, avoid touching the outer surface. Dispose of them promptly and wash your hands thoroughly. Use masks to prevent the spread of respiratory droplets. Wear a mask that covers both the nose and mouth properly. Change masks regularly or when they become moist or damaged. Discard used masks in designated waste containers. Wear gowns when there is a risk of contamination from splashes or sprays of bodily fluids. Follow proper donning and doffing procedures to minimize the risk of contamination. Use eye protection, such as goggles or face shields, to protect against potential splashes. Preventive measures, respiratory hygiene. Practicing proper respiratory hygiene is crucial in preventing the spread of respiratory infections. Follow these comprehensive guidelines to ensure a safe environment for both clients and direct care workers. Stay home if you have a respiratory virus. If you are experiencing symptoms of a respiratory illness, such as cough, fever, or sore throat, it is important to stay home and avoid contact with clients to prevent the spread of infection. Wear a mask if you feel like you are coming down with something or if you are in contact with clients exhibiting signs of respiratory illness. Wearing a mask can help prevent the transmission of respiratory droplets. Make sure the mask covers both your nose and mouth properly and fits snugly against the sides of your face. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing to prevent respiratory droplets from spreading. When you need to cough or sneeze, use a tissue to cover your mouth and nose. If a tissue is not available, cough or sneeze into your elbow. This practice helps prevent the release of respiratory droplets into the air. Dispose of used tissues promptly in designated waste containers. Used tissues can harbor infectious respiratory droplets. Dispose of them immediately in designated waste containers to prevent the spread of germs. Refrain from touching your face, particularly the eyes, nose, and mouth. Touching your face can transfer germs from your hands to the mucous membranes, increasing the risk of infection. Perform hand hygiene immediately after coughing, sneezing, or handling used tissues. After coughing, sneezing, or handling used tissues, it is important to perform thorough hand hygiene. Wash your hands with soap and water for at least 20 seconds or use an alcohol-based hand sanitizer with at least 60% alcohol. Preventive measures, environmental cleaning and disinfection. Regular cleaning and disinfection of the environment play a crucial role in preventing the spread of infections. Follow these guidelines. Clean and disinfect frequently touched surfaces, objects, and equipment regularly using suitable cleaning agents and disinfectants. Pay close attention to high-touch surfaces such as doorknobs, light switches, countertops, and bathroom fixtures. Follow recommended contact times for disinfectants to ensure the effective elimination of pathogens. Dispose of waste materials and contaminated items properly in designated waste containers. Regularly clean and disinfect cleaning supplies to prevent cross-contamination. Remember, by implementing preventive measures, we can minimize the spread of infections and create a healthier environment for everyone. This concludes our infection control training. If you have any questions about this topic, please don't hesitate to contact your supervisor for guidance.